Hello guys, welcome to MMK Clinic Advice Channel. My name is Neske.
Hello guys, you are very welcome in our channel. My name is Dr. M.
In this channel, as you all know, we give advice about different kinds of disease, what to do, and when to consult a medical help. Today we are going to talk about how to avoid a diabetes. There is two kinds of diabetes. Type 1 diabetes and type 2 diabetes. But here today we are going to talk about type 2 diabetes.
Yeah guys, we are going to talk about type 2 diabetes, but it's better to know also why and what is type 1 diabetes. Type 1 diabetes is starting at any age, but especially at a young age. Type 2 diabetes starting later in adult age, but is nowadays seen even in younger people or children. The reason why we decide to talk here about type 2 only is that type 1 is less common than type 2. Uh, Currently, no one knows uh, how to prevent type 1 diabetes, but it can be treated successfully by insulin. Type 2 is common type of diabetes. About 85% of people with diabetes have type 2. The number of patients with type 2 diabetes is increasing. And there are two main reasons why the number is increasing. Firstly, is that we live longer and diabetes become more common with increasing age. Secondly, is our lifestyle. Type 2 diabetes can be treated successfully by tablet and sooner or later even by insulin. Type 2 diabetes often develops slowly and may have not initially caused any symptoms at all. You can have type 2 diabetes for a long time, sometimes several years, without knowing about it. That's why the disease is often discovered during a health checkup.
Guys, we choose all the time or to give you the symptom or to tell you the symptom about all disease that we are talking about because we want you to understand the symptom. When you understand the symptom, you'll know also how to avoid it. That's why we give some of the symptom, not all, because we are not teaching medicine here. We just give advice about the simple things that everybody, every level can be able to understand what it means. And we are going to do all our best to don't put many medicine word that you can be able to understand. Sometimes there is another medicine word that it will be very difficult to explain to the level that everyone can understand. With that, guys, bear with us, but we are going to do our best. So I want to give only some common symptoms that people with diabetes 2 experience. The first one is urinating more often than usually, particularly at the night, feeling very thirsty all the time, feeling extremely tired, and the slow healing of cut or wind. If you see, there is another one, but we choose to give you the common one, the first that people can be able to recognize or to say, oh, what is this? And don't ignorate that or neglect it. That is the sign of something that you need to seek for medical help to understand what this means.
Guys, good if you can keep those three symptoms as very, very common. You have increasing thirst and increasing urinating. And you can also be tired. You can waste the loss, the weight suddenly, even if you are overweight. Other people can experience blurred vision. If you recognize one of or more of the symptoms, you should contact your GP, doctor, or a primary care provider for investigation, for treatment, good treatment, adequate treatment, and for follow-up.
There is also, now we are going to give you some tips to what you can do, or some tips to help you to reduce the risk of developing type 2 diabetes. Before we come that, you want to say something?
Yeah, I want to say something. Before you go to the tips, so I would like to develop a little bit more the risk factors we have about type 2 diabetes, and what you there out people need to know about why you should avoid. Then if you get this chapter, so it will help you to easier keep in your mind the advice about how to avoid diabetes. I don't think that it sounds good.
Yeah, I think so. Because you need to understand the risk factors to know where is the risk if I don't do these things, or where is the risk, like generally.
Yeah, here risk factors is those situation which lead you directly to diabetes. And then if you know what can lead you to diabetes, then you can avoid that things. The first risk is this, you can't avoid it, but it's this. Type 2 diabetes is largely hereditary. Hereditary means that we have all genetic predisposition to get the disease. Then it's hereditary. The body's insulin sensitivity. As I used to say to my patients, our human being body is working like a machine automatically. We don't have to think about what to do next. The body himself produces what we need. Then we have an organ in our body which is produced insulin, and insulin help us to lower blood sugar when we're eating. Then the body's insulin sensitivity become low. Sometimes because the insulin is not produced at a good level, or that the body's needed is not covered. Another risk factor is stress, hypertension, lipidemia, depression, high alcohol consumption, and smoking. Overweight people, and obesity increase the risk of type 2 diabetes. Weight loss leads to improvement in type 2 diabetes and reduces the need of medicine. Gestational diabetes increase also risk of developing type 2 diabetes later in life. What I mean here, women who are pregnant and who develop diabetes, that diabetes is called gestational diabetes. After giving birth, the diabetes will disappear, but those women are high risk to develop type 2 diabetes later in their life. What you need to know, what you need to know about diabetes also is that no medications, we don't have any medication that can cure type 2 diabetes. But medicines are available to manage the condition. Diabetes type 2 have a higher risk for serious complication and premature death. Complication can be prevented by earlier diagnosis and adequate treatment of glucose level and adequate treatment of other risk factors. Today is mortality about diabetes decreased. Why is that decreased? I think it's, I don't think, but according to studies, today we treat earlier, we detect disease earlier, and we give good advice together with all the team. Here I mean the doctor, the nurse, and the patient, because those three persons are a team. And then if the team working good, then we can get good outcomes. Type 2 diabetes is the most common form of diabetes. It's better to know that. And it's growing like an avalanche in the world. All the world is experiencing today increasing level of person who have type 2 diabetes. In Asia, the Middle East, in America, and even in Africa. It's better to know that because people think diabetes is only for those people and not for the other people. So that is not good. It's not true. What you also need, I think I give you more and more information about what you need to know, so it's become easier to get in how you will do it and why you will do it. Type 2 diabetes developed gradually, as I said, and nowadays it is unfortunately become increasingly common for children and young people to suffer from type 2 diabetes. The reason for this is, at least in part, that obesity and physical inactivity have become increasingly common in children.
Guys, as you understand or you listening to the doctor, there is no cure medicine for diabetes. The only things you need to know is to take care with yourself with some advice that we give to you, like to change your lifestyles, your habits that you have, so that you can be able to reduce that risk to have that type 2 diabetes. Some tips of things that go to help you to reduce the risk to develop a type 2 diabetes. One, healthy eating. You need to focus on a balanced diet rich in fruits, vegetables, whole grain, less protein, and healthy fats. Limit processed food, sugar, and refined carbohydrates. For example, white bread, white rice. Included for all your diets, vegetables and fruits. Vegetables, they are not very expensive, but put more vegetables and less carbohydrates. If for example you eat your culture, you eat more rice, try to put some vegetable too.
Guys, I think it's better we take or we will take that to next video, because when we talk about diabetes, it's very important to know that our lifestyle is playing great roles here. That's why it's better to know what kind of food, what kind of physical activity, how can I improve my physical activity, which kind of food to avoid or to not avoid. So it's better we take it in the next video, so you get very good information, very consistent information. So lifestyle plays a big role in the development of diabetes. But don't think that you get type 2 diabetes just because you ate too many sweets. It is otherwise a common misconception. The background to diabetes is a complicated interplay between both our heredity and our environment. That's why you will see there out even a slim and health conscious person with type 2 diabetes. But among severely obese people, approximately 1 out of 3 people is affected by type 2 diabetes. So, how to avoid type 2 diabetes? Keep tracking a blood pressure and keep tracking cholesterol level or lipidemia, and other risk factors should be also tracking. Maintain a healthy weight. Manage your stress, of course. As I told you in the previous video, stress is necessary for us to go out, to get out, to go forward, but it's better to manage it so it not become too much for us. Reduce your consumption of alcohol, and of course, quit smoking.
Yeah, and watch your portion size. to avoid overeating. Be mindful, guys, of your portion, especially when you are eating out or when you are doing your packaged food. And guys, sleep well or get enough sleep is also a good thing. Sleep like 7 to 8 hours with quality sleeping each night is helpful because the poor sleeping is increase the risk to get a type 2 diabetes. Guys, don't forget to subscribe, share, like, and the comments. Guys, it's also important to know drink water, instant sugary drinks, because sugary drinks can spike blood sugar level.
As I told you before, there is not medication to cure type 2 diabetes, but drug treatments is an important tool for getting control of blood sugar. It is important that both the doctor, both the diabetes nurse, and you as the patient thereout have an active attitude and do not accept high blood sugar value. So that was the information we had for you today. Thanks for watching us and stay safe. As Sister Kay told you, don't forget to subscribe, to like, to share our videos because we'll find more and more information to help you to get to help you to take care of you. And then if you get something good, so don't forget to save and give to somebody else. That's why we ask you to share also our video. Thank you and stay safe.
Stay safe. See you in the next video. Bye.
Bye.